More disturbing news about the rising numbers of people using prescription drugs. A new study in the Journal of the American Medical Association says use of prescription medications for chronic disease has surged in the U.S. in the past decade, with roughly 6 in 10 of us using at least one prescription drug. Here's Jessica Firger, staff writer at Newsweek, who covers health issues. Jessica, what are we using these meds for anyway?
The medications that have seen the largest increase, such as drugs for high blood pressure and statins for cholesterol and some other heart medications, they're all to treat conditions that typically emerge in patients who are overweight or obese. So this rise in prescription drug use may very well reflect the increase in obesity in the country, so that's a big problem. The other reason there might be an increase is really from better diagnostic techniques and just better early detection and intervention. So there was also an increase in the use of antidepressants, and the author suggests that maybe this is partially because there is less stigma around depression, so patients are more likely to seek out treatment.
I mean, just the headline of your story, estimates suggest 60% of Americans take at least one medication. And I'm not making light of anybody's conditions, but I feel like these days a doctor will prescribe something for anything.
Right. I think that people, there's always this idea that maybe there's a magic bullet, and this country is not so great at preventive medicine, and so we tend to want to put a Band-Aid when you develop a health condition. Interestingly, there was just this other study that just finished up by the NIH. It's called the SPRINT trial, and we're hearing a lot of news about that. And that study looked at earlier intervention for high blood pressure, so really giving high blood pressure medications to patients much earlier when their blood pressure is maybe, I guess you would say, teetering to be considered clinically high. So I think, in some cases we are seeing just more liberal use of certain medications, but there needs to be a lot of work in terms of improving preventative care in this country.